Come in.
Hello.
Hello.
Hi, I'm Silver. I'm a student nurse with SF State. I'm here to take a quick head-to-toe assessment on you. Is that okay?
Nice to meet you, Silver. Yes, it is okay.
Great. And could I get your first and last name, please?
Stephanie Smith,
Perfect. And could I get your date of birth?
August 19th, 1999.
Great. Looks about right on the wristband. And are you in any pain today, Stephanie?
I have a little bit of pain in my left knee from an old previous
left knee?
Injury.
Okay. How long ago was that injury?
It was in 2018.
Okay. Does anything make that pain better or worse?
Yeah, what makes it better is when I wear a knee brace, or I'll take some ibuprofen if it starts to be too painful, and sometimes I'll stretch.
Okay. And how would you rate that pain? Like a sharp, dull pain?
It's like a dull, achy pain.
Okay. And could you rate that 1 out of 10 for me?
Right now it's about a 2 out of 10.
Okay. Does it radiate anywhere else?
No.
Okay, and you said it lasts in intervals usually?
Yes, correct.
How long are those intervals?
Usually it'll hurt on and off for about a week and then kind of go away and come back after a few months.
And have you been doing anything for that pain?
Just ibuprofen occasionally
Just
when
ibuprofen.
it gets bad.
Okay, sounds good. So now I'm going to start the head to toe portion. Is that okay?
Yes.
All right, so first I'm going to be palpating your skull. I'm looking for deformities, contusions, abrasions, lacerations, swelling, and I don't notice anything significant. Feels nice and sturdy. You're good. And now I'm going to be checking your facial structure, making sure that's all sturdy too. Great. Can I palpate for your lymph nodes now?
Yes.
Okay, so I'm just looking for any swelling in her lymph nodes. Okay, feels all good. Okay, and now I am just going to check your cranial nerves 5 and 7. Is that okay?
Yes.
Okay, so I'm going to have you do a few expressions for me, all right?
Okay.
So, smile. Now frown. Raise your eyebrows for me. Smile with your mouth closed. And now, can you clench your teeth for me? Perfect. Cranial nerve 5 is intact, and now I'm going to check cranial nerve 7. So I'm going to touch different parts of your face with your eyes closed. Just tell me what I'm touching, okay?
Okay. Forehead, left cheek, right cheek, chin.
Perfect. So cranial nerves 5 and 7 are intact. Now I'm going to be checking cranial nerves 9, 10, and 12, okay?
Okay.
So open your mouth and say, ah.
Ah.
So when I'm in here, I'm also looking for any discolorations, inflammation. It all looks good. Uvula's midline, and so is her tongue. And now can you please swallow for me? Great. So cranial nerves 9, 10, and 12 are intact. I'm going to check cranial nerve 8. I'm going to assume that she can hear everything I'm saying because she's responding. And is your hearing well? Have you had it checked lately?
Yes, I did have it checked lately and everything is normal.
Okay, perfect. So now I'm going to check cranial nerve 11, okay?
Okay.
All right, so I'm going to have you shrug your shoulders. Now go side to side with your head. Perfect. So now I'm going to apply a little bit of pressure and do the same thing for me, okay?
Okay.
Shrug your shoulders to the side, back, and forward. Perfect. Feels really good. Now I'm going to check your cranial nerve 2, okay?
Okay.
So I'm going to check your pupils. Make sure they are bilateral and reactive to light. Okay, looks good. Let me do it on the other side. Looks good. Now I'm going to check the sclera and conjunctiva. Looks really good. It's clear and white, and your pupils are equal, round, and reactive to light. Okay, so now I'm going to do cranial nerves 4 and 6 and 3, okay? So I'm just going to have a pen, and I'm going to have you follow the pen with your eyes, all right?
Okay.
All right, looks good. Cranial nerves 3, 4, and 6 are intact. All right, so now I'm going to go into more of the assessment, okay?
Okay.
Okay. So I'm going to check over here for any deformities, contusions, abrasions, lacerations, and up here. Looks good. I'm going to check your radial pulses, make sure that they're strong and bilateral. And they are strong at a 2+, and they are also bilateral, okay?
Okay.
Okay, so now I'm going to go into your, actually I'm going to have you take off your socks for me, okay?
Okay.
I'm going to be checking your pedal pulses. All right, they are equal and bilateral. and they are strong at a 3+, okay?
Okay.
I'm also going to be checking for edema while I'm down here.
Okay.
No edema, feels good. Now I'm going to go and check your central nervous system reaction, okay? So if you close your eyes for me, and which toe am I touching?
The second toe.
All right, and which one here?
The pinky toe.
All right, now I'm gonna have you push down for me. Okay, now push up. Sounds good. Have you had any tingling or any pain in your legs lately? Okay, I'm also gonna do this on your hands, okay?
Okay.
So close your eyes for me. Which finger am I touching?
Pinky.
And which finger?
The thumb.
Okay, now if you squeeze both my fingers. All right, and have you had any pain or tingling in your fingers?
No.
No? Okay, great. So I'll also check your pulse back here. Very good. All right, and now I'm going to go into your cardiovascular and lung section, okay?
Okay.
Okay. So I'm just going to listen to your heart sounds really quick.
Okay.
Is it okay if I go under your shirt a little bit for this?
Yes.
Okay, so using the diaphragm, I'm just going to listen to her aortic. I'm going to go pulmonic. Sounds good. Tricuspid. And I'm going to go mitral. All right, they all sounded really good. I felt your S1 strongest in your mitral and your tricuspid, and I felt your S2 strongest in your aortic and pulmonic, okay?
Okay.
All right, but they sounded really good, very strong, and they were pretty frequent. I'm also gonna listen for murmurs now, is that okay?
Yes.
So, I'm gonna start down here. And could you take a deep breath and hold it for me? Okay, you can breathe. All right, and now I'm going to check for any bruits. Check here. And check down here. Great. Sounds good to me. All right, can I have you turn around quick? I'm going to check your lung sounds. All right, so I'm just going to have you take a few deep breaths. And on the side, I'm going to have you do one over here. Great, they sound good. No wheezing, no crackles or rails. All right?
Okay.
Sounds really good.
Thank you.
All right. Now, is it okay if I check your abdomen really quick?
Yes.
Perfect. I'm going to have you lay down, supine. You could put your legs up too. Like that. Okay. And is it okay if I go under your shirt again?
Yes.
Okay, so I'm just going to pull this up, this down. Use the diaphragm, and I'm just going to listen first, okay?
Okay.
I'm checking all the quadrants to make sure you have bowel sounds. All right, you have bowel sounds, and there's no absent sounds, okay?
Okay.
Sounds really good.
Okay, thank you.
All right, now I'm just gonna palpate your abdomen, make sure there's no distension, rigidity. All right, feels really good. Now I'm checking for rebound tenderness, okay? So I'm pressing down and making sure there's no pain after I release.
No pain.
No pain?
No pain.
Great. Okay. Put this up. And now, do you think you could sit up for me? I'm just gonna check your reflexes, okay?
Okay.
So, I'm using my reflex hammer, and I'm just gonna have you dangle your feet. All right. Wow, we got a strong reflex.
Thank you.
Yeah, really good. And now I'm just gonna perform one final test for you. I'm gonna do Romberg's test.
Okay.
So I'm gonna have you stand up,
Okay.
and I'm gonna have you close your eyes, and we're gonna test your balance for 20 seconds. I'm gonna be right here just in case you fall, okay?
Okay.
All right, very good.
Okay.
Sit down. Just have a few more questions for you.
Okay.
I'm gonna check cranial nerve 1. So, have you had any problems smelling anything lately?
No, I can smell okay.
You
I can smell
okay?
everything. Yes.
Yeah, okay. Sounds good. And I think we should be good for your checkup.
Okay.
Okay.
Thank you so much, Nurse Silver.
Yes, of course. I'll see you next year.
Thank you.